It's a session of joint symposium of Assembly of National Sleep Societies and the SRS. ANSS, the Assembly, is an important body within the European Sleep Research Society, which encompasses all the member sleep societies from European countries. And it represents more than 8,000 sleep specialists across Europe. And it's important to understand the differences, the needs of any sleep societies, because depending on the level of the country's health system, they may have some requests, for example, to help developing the education or some guidelines or some technical support regarding the sleep lab establishment, for example. Sometimes they need advocacy with the local authorities. So to meet these needs, ANSS developed an important project starting from 2019. It was developed and a pilot project, the Beyond Boundaries pilot project, was done in Yerevan, Armenia back in 2019. And it incorporated two parts. We did educational meeting, a seminar for quite a various group of clinicians and psychologists, which was attended highly and also for the first time ever supported by the Ministry of Health as a sleep event. And we also met with the representatives of different government groups like National Institute of Health of Armenia, etc., so we could discuss the needs, the problems we had. And finally, it was becoming something like a position statement paper published in an official local journal. And the developments show that it was quite effective. So this was approved by the SRS board, and the first edition, official edition of the Beyond Boundaries project was done recently in June in Georgia, also with a similar format, like an educational seminar for doctors, and then meeting the parliament representatives for medical affairs. And we were quite productive also with this, having some agreements on helping the development of sleep medicine. It is quite different, the approach, because sleep medicine is quite a varied field of different directions, like it's pharmacotherapeutic issues, devices, their customs problems, for example, approvals by the government bodies. So this could have some obstacles on the way. So helping also doing advocacy towards this kind of things could help to further their overall field development, the sleep medicine establishment in the field. And also it was interesting that the local specialists shared their views, their research also, and discussed it with a quite representative group of specialist speakers coming from the ANSS side. We plan to continue. There is a special form of application. So the countries or societies in need for some help in the above-mentioned formats, they can apply, and we decide on the dates and the program. For example, for the next year, we already have an application from Bulgaria. And their main goal here is education of local specialists. And we are now trying to develop an appropriate program, specially designed for their needs.